fellow viewers, you're welcome to Child and Society, the program for you that discusses issues that concerns you, your family, your state, and also that showcases good role models within our society. Your regular presenter today is Vivi Colley. With me are
Chief Kate Anoloe, former Mayor of London Borough of Enfield. Good afternoon, everyone.
You're welcome.
Thank you.
And Kate Okonkwo, Senior Lecturer and Head of Practice Learning. You're welcome, everybody.
You're welcome to the studio.
Yeah.
Hello, viewers again. Today's program is going to be on healthcare delivery in Nigeria. We want to look at what is going on with our healthcare delivery. We know that since 1999, there have been healthcare in Nigeria, national healthcare for certain people. Does it get to everybody? What is going on in Nigeria with regards to the Millennium Developmental Goals on health? How are our hospitals? How are we doing at federal level? How are we doing at state level? And how are we doing at local government level? What do we have there for meeting the needs of our patients, our communities? Today we're going to be looking at it. Over to you, Auntie Chief Kate.
Thank you very much. Can I say hello, everyone, again? I think I have to start by saying health is wealth. Because no matter amount of money you have, if you're not healthy, you're not going to enjoy that money. And for me, someone who has been a health professional for over 30 decades in this country, it is very, very dear to me. And I like to look at the issues back in Nigeria, my hometown, and I would really like to take my skill to them. And having gone through the health provision in Nigeria, it really hurts me to know that out of 100,000 children, we have 840 dead. That is under 5. And why is this happening? And myself as a midwife, I regret to know that in this 21st century, we still have 1 out of 23 women dying in childbirth or during pregnancy. So this is a big concern to me, and really it's a matter of we discussing and wonder why is this happening and how we can do that. I know that we have signed up to the Millennium Development Goal, and reducing child mortality is one of them. And also, we are meant to reduce from, at the moment, under 5, you have 143 deaths, out of 1,000. But they want us to reduce it to 71. I actually want to reduce it to nothing, so we shouldn't be having deaths at all. And likewise, adults as well. And in general, every aspect, I talk about child and mothers because obviously as a midwife, that is very dear to me. So I really think and I hope that following this discussion, some of you would ring in so that we can talk about health, because this is very dear to everybody.
Okay, can we just talk about the types of healthcare that we have in Nigeria in different states?
So we're looking at within the communities, we're looking at the federal, we're looking at the state, we're looking at local government, and we're looking at within the communities, what healthcare do we have? Similarly, in this country, we have community care, we have nurses, we have midwives. Yeah. We have primary healthcare GPs. Those are the people that we have within this country. But similarly in Nigeria, what do we have? What are we meant to have in the first place? And if we have them, is it working? So let's say, for example, somebody is ill in the village and wanting, an older woman, for example, she has dementia and she's wanting to be diagnosed, confused, wandering around, wanting to be diagnosed, and is taken to a local general hospital. What services will she receive? Will she be diagnosed properly as somebody who is having dementia? And if she's diagnosed, what treatments are there for her? So these are the areas that I want us to discuss a bit further.
Okay, right. We are looking at simply how the states of Nigeria are ensuring that there are healthcare within all levels. Federal, we have teaching hospitals meeting the needs of the urban areas. We have states and we have local government. Let's go think about, within the local government, do we have standard health centers? Are those health centers equipped? How well equipped are they? Have they got water? Have they got electricity? Have they got equipment? Have they got generator? What's happening? Do the centers meet the standard expected of them? For example, the Millennium Goal says that we should spend more money around controlling malaria. If there are no funding from our side, are we able to control malaria? Yeah. In your own area, for example, talking about children, immunization is left for public health. Can you just talk about it a little bit?
Yeah, as you know, in this country, immunization is, in fact, you don't even have to remind the mother about the child being immunized. At the moment, I help in children's center, and I know the first thing they come say, "Oh, Auntie Kate, I'm still waiting for letter because it hasn't come. I'm supposed to, my child to be immunized." So that means really they know what is happening. Unfortunately, back in Nigeria, we do have people who do not believe in immunization.
So, Sister Auntie Kate is not talking about the culture, the issues around culture within Nigeria. Nigerian government have carefully built centers for mothers to take their children to. But are these mothers aware of it? Some of them may be aware of it, but does the culture make it possible for them to just focus on going to see a midwife or a pediatrician? Or would they rather be looking at, maybe let me go and see one local native doctor there, or local midwife? No, my mother didn't go to a doctor, so I'm going to go to meet that lady or that old man to give me some local drinks to drink. So that's cultural issues, isn't it?
It's all about awareness, though, isn't it? It's people understanding what they need to do for their children to keep them healthy. Now, culture comes into it, religion comes into it, tradition comes into it. So if we look at why people may not have those information, for example, 70% of our healthcare is provided in urban areas, where 30% live. So in rural areas, many people, as Auntie Kate is saying, are still believing in their culture, believing in their traditions. So instead of going to hospitals, as they should do, because they don't understand the system, they haven't actually been taught about the system, they go to traditional methods, and people lose their lives. Many people lose their lives by doing that. So how do we get doctors to stay? Because statistically as well, our doctors, in 2005, we had 2,500 doctors, Nigerian doctors, in England alone. And in America, it was more than that.
Yeah, that means we're brain drained.
Exactly, we're brain drained. So if people in the rural areas are needing medical care and they're not getting it, how do we get it to them? How do we make sure that these doctors do not leave our countries and go to other countries to work?
It's very difficult if you haven't got enabling environment to tie a professional who really wants to advance. You can't. It's impossible.
Yes.
You can't tie them. Therefore, obviously, we are not. Our country, Nigeria, is doing its best to make sure that there are facilities within different local government area in the different states to cater for people who are sick. But even then, it's still not meeting the needs of the people. And what we're looking at is it meeting the needs of the people. You can't stop a professional who wants to go. They can go. Enabling environment is what we're talking about mainly, I think.
I think the most important thing is education. We need to go back to basics. That is educating, families. The reason why their children should have immunization.
Exactly.
Because if you don't explain to me and I don't understand, then I listen to the traditional doctors. I listen to them. But if you can explain to me and educate me, in fact, it should really start from schools, so that as children grow up, secondary school, they are now re-educating their parents, or their grandparents who might be onto them and say, this is what I did and your mother did that, so you should be doing the same. So I think the most important thing is education. If we can have, health care professionals going into schools,
even healthcare assistants,
going into schools to educate, have a session where they can speak. I mean, for example, a lot of us that are highly educated here in health, we actually want to go back home and help, because I know that we've acquired so much skills. Then the government here don't need us,
so
but we are needed back home, and I would like, the new government to look into getting, either one way or the other, but it's important they look into the diasporans that are here. Majority of them really want to come home to help to build up our health service. We might not have the national health service as it is in this country, but with our skill, we will be able to build up, to educate from the grassroots, because that's where it should start. A lot of the people that you might think are helping, all those where they do travel out and they are fine. But we really need to get people that are already out, worked here, to go back to Nigeria to help and educate so that our children can be immunized. At the moment, it's only 42%. And with the Millennium Development Goal, we want 100%. Are we going to achieve it? And this is 2015.
Yeah, you are right. Gupta in 1999 says that we have only got 20% of people. That's the only that Nigeria is only catering for 20% of its people. That's in 1999. However, we know that with the Millennium Goals, we're hoping to, as Auntie Kate said, we're hoping to do better. Yeah, record shows that we're hoping to get to 75%. But are we going to get to that if we don't have education for the people to know what they ought to be doing, to make people aware of the need to ensure that they seek medical help early before it gets worse, to get people to know about the importance of going to doctor to be prescribed medication rather than self-prescribing, which they do to themselves by going to local chemists and buying medicines that have been outdated. So that's what we're talking about. A lot of more professionals need to be doing grassroots work to ensure that that people become aware of how to assess healthcare in Nigeria. Viewers, as you know, there is healthcare in every state in Nigeria. Nigeria is not new to providing health care for its people. However, is it working? What are the performance indicators? What is it telling us about? We're going to be going for break in a minute. So I ask you to sit tight wherever you are watching this program until we come back so that we can continue to looking at ways to solve these problems. Hello viewers, we are back from our little break. Now we're going to be looking at what do we look out for in healthcare delivery system. I mean performance indicators. With me today are
Simisola Dabiri, team manager.
Susie Retiella, host of Reality at the Moment with Susie.
You are welcome to the studio.
Thank you.
Now, we've been talking about healthcare delivery in Nigeria. I would like to find out from yourself what you understand as the performance indicators. What should people be looking out for? What standard should Nigeria healthcare system have? For example, in the teaching hospitals, in the federal, in the state hospitals, what do you need to be seeing? Good hospital, good environment, water. Tell us something about that. The staff, the nurses, the doctors, and so on and so forth.
Provision of service is all about the outcomes, and the outcome has to be is that a person goes into hospital or attends A&E and actually gets the service they're supposed to get and walks out in the best healthy state that they can. In order for that to happen, a number of things need to take place as well. So it starts from the front door, it starts from reception. It starts very much from once they get to reception, what happens there? You know, what's the expectation of the service user, i.e. the patient and what's the expectation of the person on reception. And it has to be a speedy delivery of service. It cannot be, that the receptionist is waiting for somebody else to provide information. It can't be that the receptionist is saying, have you paid, have you not paid? All those things need to be resolved prior to that.
Do people pay for services?
They do pay for services because, you have basically we have a two-tier system in Nigeria and most African countries anyway, across West Africa. A part of it is private healthcare, which is fine. You walk into a hospital, if you're going private, you know that you're going to pay, you know how much, or you're told how much. If you're walking into a teaching hospital or government funded hospital, that is totally different. That the point of delivery of service should actually be free, from free in inverted commas, but people do pay.
Okay, let's talk a little bit about, obviously Nigeria have now started with this private national health
insurance, yeah,
which means that the rich pays insurance for their health. Then the poor can't afford to pay, therefore they rely on the state hospitals and state healthcare. Well, are those state healthcare well equipped to meet the needs of these people? I went to a hospital once and there was no generator at night. Come on, tell us.
Well, I think it's really unfortunate. It seems as if the state-run hospitals are less equipped than the private hospitals. Private hospitals belong to the rich, and so they are kept up to a good standard to encourage the rich to keep on going there. Meanwhile, the state hospitals are, it's really sad what you see in some of them, and I can remember them talking about one hospital having rats in it. I went to a hospital, dirty sheets, torn sheets. So no, it's just not good enough. So the government needs to think of what they are putting into these hospitals. And when I say what they're putting into the hospitals, I'm talking about the resources and the equipment.
Right. I know that Nigerian government are doing their best. I know some hospitals have been well equipped in my in my own state, well equipped hospitals, but when you go back there after a few months, you don't see sheets on the beds. You don't even see anything. Who is taking those things?
It's the staff, isn't it?
Yeah, I think it's the staff.
At the end of the day, let's be realistic. If you have staff that are not well paid, they are not going to be motivated to do the job. They are not going to respect the equipment within the premises of the hospital. They're going to steal some and take some home. And also,
so you're talking about the culture within.
Yeah, so the equipment goes somewhere. The bed sheet goes somewhere. And also, if there is no one there to monitor it, what happens?
But every hospital is supposed to have a matron, a hospital administrator. Somebody needs to be checking those things to ensure that performance are being...
The problem is there's no checks and balances. Yeah. There's no checks and balance. And I think, like Susie said, I think Susie's totally correct in the sense that if you don't pay people enough, they will actually find some other means of making sure that they can pay their rent. They can put their children through school.
Does that
so
explain
the issue of corruption enters that.
Does that explain the reason why some doctors will, or hospital, the doctors in charge of particular healthcare organizations should really be lifting things like generators to their home?
Well, it shouldn't,
because
but
they are well paid as well.
You say they're well paid, but I remember being in hospital in Nigeria and the doctors talking to me, a patient, about what their fellow doctors earn abroad. So they know that they could get better money if they went abroad, and some of them don't have the means to go abroad, so they're frustrated anyway. I think another thing is nursing, correct me if I'm wrong, is not such a respectable profession within the Nigerian society, yet it is a vital profession within society. In America, it's a very good profession to get into. Here in the UK, in most Western countries, it is a very respectable profession.
We know that it is standard that every hospital should have at least a pharmacy. A pharmacy that is well equipped. How equipped are Nigerian hospitals?
They're not equipped.
Pharmacists.
They're not equipped. They're very poorly equipped.
Why is that?
Well, most of it is okay. The GDP that is allocated to health is like 4.6 from what I can remember. the expenditure that actually goes out is 1.3, 1.4. So therefore, there's a great gap between what the government allocate and what is actually spent on.
So where's the rest of the money then?
Yeah,
that's
so there's a massive
3 million.
gap.
That's 3 gone, isn't it?
Yeah. So therefore, when you're talking about the pharmacy, that is some of the money that from that allocation should go to the pharmacy. It doesn't go to the pharmacy. You know what does happen, and I can't say everybody does it, but what does happen a lot is that the doctor will say, okay, here's your prescription, go to so-so pharmacy, go and get so-so medication.
And who is the owner of that pharmacy? That
sometimes it belongs to the doctor and the doctor's family.
Yeah. Can I add that, bearing in mind you have state hospitals that are meant to be free, you have, you know, a country that has a high majority of people who are living below, you know, the normal standards of living, so don't have money. And so a lot of them won't go to hospital. They will go to a pharmacist, because they'll get to the pharmacist and say, oh, look at my leg, I've got a big cut on it, what do you recommend? And it's cheaper for them to go to that pharmacist. So that's why I think laws need to be in place about the role of what a pharmacist is, a role of what, you know, about what the role of the hospital is, and also, you know, committees need to be put in place by the government to look and review at what is happening. You have to start from the top level before anything can be done.
In order to meet our Millennium Developmental Goals around health, you're saying that there need to be communication.
There has to be a committee.
Yeah, communication must reach those patients.
It has to.
And the potential patients.
I think that there's two things that need to happen as well. I think that the expectation of the patients, what the patients should expect as a service provision should be clear. What the doctors and the nurses and the rest of the health staff should be providing should be clear. Both parties should be aware of that.
Viewers, we are coming to the end of this program. As you have heard, we've discussed issues concerning the healthcare delivery in Nigeria. Government is not different from people, because you, the beneficiaries, you, the officers and professionals working in the hospital, you are the same as the government. So if our hospital services or delivery is not working effectively well, we all have to sit up and work together to ensure that the government premises that have been given to us are well kept, that the hospital equipments bought by federal government are well looked after and that are not stolen, that the generators are there on the premises. Is your responsibility, my responsibility, to make sure that if it goes working, that we are able to say who took them. Now that drugs in the hospital are not misused by people by stealing it and selling to themselves. Viewers, as we have spoken today, I'm hoping that next week you will come back again and watch this program. Stay tuned, because we have not exhausted this program, but my manager is telling me that it's time to close today. Therefore, I'm going to be saying thank you very much for watching. Stay tuned and watch every week at the same station, the same time. Thank you for watching Child and Society from Vivi colleague and my colleagues